What are congenital diseases? A congenital disease is a condition existing at birth and often before birth, or that develops during the first month of life, regardless of causation. A healthy body and a sound mind are real blessings to mankind, and those of us who possess them should be thankful that we've been blessed with them. But sometimes life isn't as easy as it seems. Have you ever imagined how difficult life is for people born with birth defects, deformities, and diseases? Give it a thought as now we focus on some of the rare abnormalities and deformations in congenital diseases. Any abnormality or deformity can be both physical, mental, and could be a result of an abnormal change in genetic structure or function. Several abnormalities manifest themselves as a missing body part or an extra limb or digit. To our surprise, the causes of such deformities are highly varied, and many of them are still unknown.
Ectopia cordis is a congenital disease in which the heart is exposed on the chest wall because of maldevelopment of the sternum and pericardium. Ectopia cordis occurs in 5 to 7 per million live births, and it has an extremely high mortality rate. Abbott first proposed ectopia cordis in 1898, although cases of patients with similar defects had been described for decades with other designations. This abnormality is classified into 4 types: cervical, thoracic, thoracoabdominal, and abdominal. The abdominal group include patients with an anomaly of the abdominal midline, who met the defining characteristics of the disease. In 1958, Kendrell reported a syndrome with 5 defects: anomalies of the chest wall, abdomen, diaphragm, pericardium, and heart.
Microcephaly is a very rare neurological condition in which an infant's head is significantly smaller than the heads of other children of the same age and sex. Sometimes affected at birth, microcephaly is often the result of the brain developing abnormally in the womb, congenital, or not growing as it should after birth. Children with microcephaly often have development issues. Development delays are speech and movement, difficulties with coordination and balance, dwarfism or short stature, facial distortions, hyperactivity, mental retardation, and seizures. Microcephaly can be caused by a variety of genetic and environmental factors. Causes include craniocytosis. The premature fusing of joints between the bony plates that form an infant's skull keeps the brain from growing. Treating craniocytosis usually means your infant needs surgery to separate the fused bones. If there are no underlying problems in the brain, this surgery allows the brain inadequate space to grow and develop. Chromosome abnormalities such as Down syndrome, decreased oxygen to the teal brain, infections to the fetus during pregnancy, exposure to drugs or alcohol, or certain toxic chemicals in the womb, severe malnutrition, and uncontrolled phenylketonuria, also known as PKU in the mother. PKU is a birth defect that hampers the body's ability to break down the amino acid phenylalanine.
The disease is categorized by congenital skeletal malformations and heterotopic ossification, or bone growth outside of skeletal tissue. It is considered the most catastrophic form of HO, with episodic flare-ups leading to cumulative immobility. FOP is an autosomal dominant condition with a 50% chance of a child developing the disease if one parent is positive. There are no differences in prevalence rates across racial or ethnic groups and geographical regions. The severe disability associated with FOP often results in poor reproductive fitness. To date, there are fewer than 10 multi-generational families afflicted worldwide. A curious aspect of this condition is that the majority of diagnosed cases are spontaneous mutations with no apparent hereditary link. Within the first decade of life, inflammation and a swelling of soft tissue can be seen. These swellings can be painful as they transform the soft tissue into bone. Typically, the first indications of this disorder appear in the back, head, neck, and shoulders. After a certain amount of time, spinal deformities become apparent. In early stages, new growths can appear rapidly, sometimes overnight. Various triggers have been identified with FOP, such as trauma to muscle or connective tissue. Dental work, bumps, bruises, or falls can lead to new bone formations.
There have been many recent advancements in Ectopia cordis, but one of the most astonishing is its relation to Kendrell's pathology. Kendrell's pathology with Ectopia cordis is an extremely rare and lethal congenital anomaly. The complexity of this syndrome is usually incompatible with life, making both of these abnormalities more lethal than usual. Cancerospermatology is characterized by a combination of birth defects, which in all making the surrounding tissue on your chest a bit more vulnerable than usual. The thin membrane that lines the heart becomes extremely sensitive in cancerospermatology, and the addition of ectopia cordis makes it even more sensitive. Researchers have uncovered that these disorders combined can cause severe and life-threatening complications. They have also realized that most cases are believed to occur sporadically.
In the past few years, the increasing accessibility of technology has translated to a number of significant advances in our understanding of brain malformations. Genes causing brain malformations previously intractable due to their complex presentation, rarity, spadioric occurrence, or molecular mechanism are being identified at an unprecedented rate and are revealing important insights into central nervous system development. Recent discoveries highlight new associations of biological processes with human disease, including the pathway in brain overgrowth syndromes and the trafficking of cellular proteins in microcephaly capillary malformation syndrome. Several other gene discoveries expand our understanding of the role of mitosis in the primary microcephaly syndrome and post-transitional modification of dystrophin and in lissencephaly. Insights into polymicrogyria and heterototosis show us that these two malformations are complex in their etiology, while recent work in heteropostocephaly and Dandy-Walker malformation suggests that at least in some instances, the development of these malformations requires multiple hits in the sonic hedgehog pathway. The discovery of additional genes for primary microcephaly continues to impress upon us the significant degree of genetic heterogeneity associated with many brain malformations. It is becoming increasingly evident that the next generation sequencing is emerging as a tool to facilitate rapid and cost-effective molecular diagnosis that will be translated into routine clinical care for these rare conditions in the near future.
After years of searching for an answer, researchers at the University of Pennsylvania School of Medicine have located the skeleton key. These researchers have been allowed to build on past findings and have come to the conclusion that FOP is the first human genetic disease ascribed to ACVR1, or activin receptor type Ia. This is also known as a BMP receptor, which is a protein that helps determine the fate of stem cells in which they are expressed. They are exceptionally crucial because BMP receptors repair the skeleton. In FOP, the ACVR1 gene is damaged by the substitution of a single genetic letter at a specific location in the gene. The single nucleotide substitution changes the meaning of the genetic message encoded by the ACVR1 gene. Thus, the substitution of one genetic letter for another out of 6 billion genetic letters in the human genome, the smallest and most precise change imaginable, is like a molecular terrorist that short-circuits a functioning set of muscles and connective tissue and transforms them into a second skeleton, in essence turning a light bulb into an atom bomb, says Kaplan, a researcher at the University of Pennsylvania. Recent studies have shown that this gene is supposed to signal the growth plates of growing bones and tissues, and in those with FOP, when it is triggered, it acts as if all tissue is bone, therefore turning the soft tissue into a bone-like structure. Congenital anomalies and preterm birth are important causes of childhood death, chronic illness, and disability in many countries. Taking supplements prior to conception and during pregnancy decreases the risk of these defects. However, there is also a genetic influence to this type of congenital anomaly. The vast majority of congenital abnormalities have no known cause. This is particularly troubling for parents who plan to have more children because there is no way to predict if the problem will reoccur.